So you've been diagnosed with endometriosis. What now? Endometriosis is old endometrium sticking to the lining of the uterus. It's a little bit like when you're cooking and you cook stuff and the pot's boiling down and you get all this stuff stuck to the side of the pot. That's a little bit like endometriosis, okay? Every month you get your cycle, your menstrual blood flushes everything out in preparation for next month's laying down of the endometrium. Endometriosis leaves bits of the endometrium inside the uterus there, and what it creates is a lumpy, bumpy barrier there. How do you usually know you've got endometriosis? You have strong cramping pain and clots in your period. If you've got that, and the worse it is and the larger the clots are, the worse your endometriosis is. You don't necessarily need to get a diagnosis from a gynecologist for endometriosis, strong cramping period, pain, clots in the menstrual blood, maybe dark or purple blood, menstrual flow as well. Those three things, that's what you've got. So, what are the treatments for endometriosis? In the West, they have surgery. They'll go in there, it's called a D&C, they'll literally go in and scrape all of the old endometrium from all around your uterus. Typically, after having a D&C for endometriosis, within about 6 months, the endometriosis comes back. It sounds like they've treated the symptoms, not the root cause. What's the root cause of endometriosis? What they've noticed is that every month a new layer of blood called the endometrium lines the uterus. Endometriosis is when blood from previous menstrual cycles has remained inside the uterus and hasn't been washed away at all. These can build up over time, create lumps and bumps inside the endometrium, which has been discovered that the smoother the endometrium, the more likely an egg is willing to implant in it. In Chinese medicine, it's the blood that flushes the menses and it's the blood that lays down the endometrium. If you are suffering from endometriosis, we call it blood stasis. Blood stasis is a sensation of having a fixed pain, fixed stabbing pain, or a stabbing pain in a fixed location. Pretty well much what you feel when you get those horrible cramps when you've got your period. That's what we call blood stasis. Chinese medicine's theory says that it's liver blood that flushes the menses. The liver's job is to ensure the smooth flow of blood throughout the body and ensure smooth flow of the period. So when you've got cramping pain, clotted menses or dark menstrual blood, we know that the liver blood is not circulating properly. The main treatment for endometriosis in traditional Chinese medicine is to circulate the liver, make sure liver blood flows properly, remove blood stasis to alleviate pain. These three things are very easy to do by using acupuncture and Chinese herbal medicine. The difference between using surgery and Chinese medicine for your treatment for endometriosis is that surgery definitely works. They will get rid of your endometriosis. However, typically within 6 months' time, it'll be coming back. And if you haven't fallen pregnant in that time, you may have to go through that surgical operation again. The advantage of using Chinese medicine is that we treat the root cause of the problem and get rid of the endometriosis and prevent it from coming back. Effectively, we have provided you with a cure. The treatments that we use are designed to completely flush the menses, remove any obstruction that's inside the uterus, so that for your next cycle, you will lay down a smooth and healthy layer of endometrium, filled full of fresh red blood.